Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Welcome back, everyone. Episode 2, Doc. Welcome back.
Woo.
We made it.
We're
super excited, guys. Episode 1 was great. We're super thankful for those who have been able to watch it. This is exactly what we've been hoping for. Those who have been excited to see this, we've been getting texts. I know that it's been something that we've been planning for a while, and so thank you so much, everyone, for your support. And we're going to continue doing this weekly and consistently so that you guys can get the value that you deserve, and we're able to help with that. So yes, Thank you guys so much. Episode 2 is here. Today, Dr. Jace and I are going to be speaking on muscle growth and how that impacts whole bunches of parts of your life. And we're talking anything from performance, we're talking longevity, obviously prevention of injury. These are the crucial things that comes with gaining muscle, growing muscle, and obviously keeping muscle as we get older. So we're going to talk all about that. Obviously, guys, if you have questions towards the end, please let us know. But we're going to jump right into it today. So, Doc, let's talk muscle growth. We're going to kind of jump right into it. What is the underlying factors that contribute to muscle growth, kind of briefly, and where can people kind of get started?
So when you look at muscles, and I'm going to use the word tissues often, when I revert to the word tissues, I'm talking about not only muscle, ligaments, tendons, fascia, to a certain aspect, bone, because they all stem from what's called fibroblasts. It's just a deep cell, and that can get formed into other different cells, which can make up part of your body. Now, the one unique part with this is when you break down the body, and as it grows from a child at birth and those different phases on and how it develops the nervous system, it develops the limbs, the eyes, ears, nose, throat, the whole system. It lays down parameters on how the body can form and function. And where we're at right now and our understanding of especially evolutionary process of our ancestors way back when, there's a couple of fascinating things that we can see from this. When we look at, as we formed, whether it was crawling in trees, whether it was scavenging the earth, a lot of it was based off of what our bodies and what the surrounding obstacles were around us. So when we learned how to walk, we learned how to then stand upright and scavenge and see the horizon. That also allowed us to throw more objects. It also allows us to run more fluently over hundreds and thousands of years. But there's a couple of interesting changes from that, some of which is, and I found this kind of fascinating, there's a muscle in the back of the knee called the popliteus, and that changed and it switched from a muscle that pretty much stabilized both bones in the bottom portion of the shin, and it crossed the knee, which now controls locking and unlocking the knee. Evolution is not always positive. It can also be detrimental to humans. We have to deal with kind of where we're at in this time frame and how can we improve the human race moving forward. And that's where I want to come back to in terms of growing muscle, in terms of how their system works. A lot of it is through dynamic systems theory. It's pretty much a basis of how our bodies function and form. There's a cardiovascular component where we need blood, we need oxygen to the tissues for them to perform. We also have some of the waste products that get filtered out through breathing. CO2 then leaves the body via the breath. There's a lot of stuff that are happening at multiple times in multiple ways, to where when we're asked the question, if we're injured, how do we rehab these issues? How do we bring this tissue that is damaged, heal it, and allow proper function? And that is very individualized for each person. So to give a full spectrum of this is what you should do as a broad spectrum is hard until you understand and know how to assess yourself. And that's where we're going to get into. So when we look at a basic theory that most of us learned in high school, the sliding filament theory, it's pretty much to where myosin and actin, they move upon one another, thus bringing the muscle in a shortened range. People think of it as a pulling mechanism. However, there's a lot of different aspects with this. So, for example, when I bend my elbow, shortening or concentrically contracting the bicep, there's also a bunch of other tissues that are involved on the outside portion and in the inside portion. So when actin and myosin come together, you bring the muscles closer together. Not only does that occur to shorten the muscle, but if you look at the tissues on the opposite side or even around the sides, they also permeate laterally, which is something that they don't really talk about in school, especially when you look at how certain proteins function in petri dishes, if we will. When you move your muscles, we have to take rotational movement into consideration. We have to take in consideration also the signaling of the nervous system to those tissues. So the main parameter regulating muscle tension was regulating muscle firing sequencing. Starts with the joints first, and if there's any problem with any of the joints, it's going to cause overlying muscle tightness, guarding tension, and then that's not going to allow the sliding of the filaments. You have to look at the signaling first, and it starts with the joints. So type 2 afferent signal that goes up to the brain and with there's no delay. However, with certain muscles and other tissues, the signal gets put to the spinal cord, slight delay at an interneuron, and then gets kicked back up. But after that signal is already sent up, it's already going to send a guarding signal from the joints to tighten everything up. So we have to start with the joint first. Now, going back to the muscle, I want to go into how we can grow muscle in terms of hyperplasia that has been still theorized. So when we look at muscle, what we know thus far is the myosin or the muscle spindles grow in size. They don't grow in number. When we're looking at the muscle fiber and also some of the materials around it, there's aspects to where it can pump up and cause more swelling, more fluid retention around it, whether that's the sarcoplasmic reticulum, the mitochondrial reticulum. We just don't know in terms of the size growth. Is it actually completely the myosin, the muscle spindles growing, or is it the fluid around it? Between actin and myosin has come together, the shorten and whatnot. There's an optimal range that allows for greater signal of force production. So there's certain aspects that we're learning, especially in this last few months, that have come out to where we're starting to understand more. And we're going to come back to some of the newer literature. You may have heard of type 1, type 2 muscle fibers. There's a spectrum of this. So type 1 are muscle fibers that are active for longer periods of time to where they produce a lower generating force. Often you see this in people with cardio. Usually those muscle fiber types, type 1, are usually smaller in size, but not always. When they look at a cross-sectional of a muscle study that they biopsied for marathon runners, they see that those type 1 muscle fiber cells are actually larger than some of the type 2s, and they vary depending on the whole muscle belly. They vary depending on the location. It's all dependent a lot of times based on the demand against their activity over time. So there's type 1, lower level generating tissues. Then there's type 2A, type 2B, and type 2X. Type 2X is the most explosive, powerful muscle fiber types. They're not often in everyone that we've biopsied, but there's also limited biopsies that we've read as well.
So that must impact athletes or those who are better performers, probably have a good chance they have type X.
More than likely, yes.
Sure.
But you can change the parameter from type 1 to type 2A, but you can't go from type 1 muscle fiber type to type 2X. They can only change to a certain amount, and some of that goes to, in terms of DNA on a cellular level, what's known as a Hayflick limit, where the tissues can only adapt so many times throughout the life. They're saying in some of the literature that this was a study back in 1970, I can't remember the name, but they noticed that the cells, in terms of how they adapt over so many times, can generate and regenerate somewhere around 50 times. And a lot of that's based on telomere length, where once they adapt so much, there's less telomeres at the end, which doesn't allow the body to adapt. So you have to take really important cautions of getting the most out of every exercise, of every single time that you move away. Everything should be intentional. So as we're looking at either training individuals, as we're looking to improve just even the average Joe coming in, you want to be, like I said, intentional, 1. 2, we want to make sure that we're training and moving in the direction of what our goals are for that time frame or for that sport. But I think it's wise, Doc, to understand some of the nutritional aspects.
Absolutely.
So we can have a proper output. What do you see of what is needed for certain tissues?
Absolutely,
to function?
and we all know, obviously, we were in grade school when they came out with the pyramid of food and just all the other things that's needed for nutrition. Before I jump into that, I just wanted to really quick ask questions on the last topics that you just had brought out. So when you had when you had talked about how everything starts at the joint, you were talking just because the afferentation, there's no delay there. And you're saying that the output of information is going to be coming from the joint the quickest because there's no delay in communication there.
It's the joint bypasses the signal from the spine, it gets straight up to the brain.
Sure.
To where more of the other tissues like muscles, ligaments, tendons, muscle spindles, Golgi tendon organs, they cross over the spine at the interneuron, slight delay, and then kick back up.
Sure.
So when the signal was already sent from the joint, it already sent the signal back down.
Got it.
Before everything kind of got sent back up from there.
So that's why obviously joint health is crucial if we train. I mean, that's going to be very little delay in communication. The brain and the joint are pretty much talking pretty much hand in hand, is what you're saying. Got it. And then moving to the swelling concept you had mentioned,
yes.
I'm sure most of us will familiarize that with a pump, right?
Yes.
The pump. And you were saying, do we really know if that pump is more fluid or is it actually more tissue?
Exactly.
And you're saying that they're still trying to kind of figure that out. Okay.
Yeah, the part with that is that we can supply and store limited amounts of, I guess, if you will, carbons within the tissue, of which through the creatine phosphate system. And that's the first amount of energy that can get expelled really quickly. And that's where the creatine supplement often comes into play really well. And people often look at this in terms of creatine will make you swollen, it'll kind of blow you up, and then you stop utilizing it, it doesn't, which makes a lot of sense. Storage then goes into the adipose tissue, which for the health, for the tissues, muscles, ligaments, tendons, fascia, but there's also a component to brain health, which is kind of,
and then the last thing was when you had talked about only tissue can only regenerate so many different times. I like that you hit on, this does mean we should be efficient with our exercise because you had mentioned we only get a finite amount of times it will regenerate. Yes. So that's cool that you pointed that out, because I know there's a lot of influencers and trainers out there that are breaking down movements to in absolute specificity so that you can get the most out of your workouts. I'm sure you'll get into this too, but there are workouts that probably give you a higher yield of outcome versus another. So that's a crucial point too. Not only are we looking to impact yield, but we're looking to impact its longevity over time, since we're having a finite time of regeneration. That's cool. That's really cool. I'm learning stuff today, guys. We're learning stuff. But no, that's awesome. So yeah, like Dr. Jace said, when we have to grow something, we got to have the foundation to grow it. And so what's essential? Essential water is number one. The human body is made up of 60% water approximately. So if we're not hydrating, like we know, that's going to be an important part. you're into that gym, you know that you're sweating, you're already losing water. So we're going to need to replenish that. With water loss will also come electrolyte loss too.
Very true.
And so we want to make sure that we are getting appropriate electrolyte replenishment as well. There's a lot of times where people will feel like they're dehydrated and they drink water. It's not necessarily that they're dehydrated, it's more or less that they need to replenish their electrolyte. So those things are important. Electrolytes, magnesium, sodium, potassium, those are the kinds of things that we're talking about. Just making sure that not only are you consuming water to help replenish the body, especially with electrolytes, some of the simplest things that you can do is just adding salt to your water before you go work out. I know a lot of trainers are starting to even push for a very simple pre-workout, which is just Himalayan salt into water before you work out. I have tried that before, and it's worked immensely better than even some of the pre-workouts. I don't take pre-workout anymore, but it's a game changer for just that simplicity. So yes, making sure that you're replenishing both electrolyte and your water is going to be crucial. There are ways to tell if you aren't getting enough water. Some of the things will be darker urine. You're going to maybe feel fatigued, maybe even dizziness during workouts. If you consume a lot of caffeine, if you consume a lot of alcohol, those things will dehydrate you. And so just making sure that if you are doing those things, you're going to want to drink more water. The idea for adults is right around 2 liters. I can't remember the last time I drank 2 liters of water, so I know I need to get up and improve that, especially in warmer climates too. Arizona, we're getting, obviously right now it's cooler temperatures, but when you're in those warmer climates, you're going to sweat more. So for adults, it's about 2 liters. Yeah, water is essential. We know that. But when it comes to growing muscle, we're going to need a lot more than just water. We're going to need sustenance, calories. So we'll break down each macro one by one, but we're going to start overall with just calories to begin with. So Doc, as I've known, we've done the hard work of either bulking or putting on some tissue, and it's a lot harder than people expect.
Oh yes.
And I think it's hard for a couple reasons. One, people don't honestly know how much more calories they have to eat. Maybe they don't understand how many calories they burn, and so that's already putting them at a disadvantage when they don't understand that number. Ways to measure that. There are machines out there that I'm sure most gyms have. They're body analysis machines that can break down not only your fat distribution, but your muscle distribution, just the kind of discrepancies between the two percentages. And then I think it also can help measure your caloric output. It's those kinds of metrics that are super important to note. And so with total daily expenditure, you're going to need to know just how much more to eat or how much less to eat if you're trying to either boost or lose weight. Right now with calories, there needs to be a surplus if you're going to gain. If you're going to lose, there needs to be a deficit. That's the end all algorithm if you're going to grow, if you're going to lose weight. So not all calories are the same, and with each calorie is going to come certain benefits depending on what you're eating. So number one, we all know if we're going to put muscle mass on, you're going to need protein. Protein is probably the most tracked, I would say, macro if you're going to start putting on mass, especially muscle mass. Protein contains 4 calories per 1 gram. So with differences we're going to see in the future, or just coming up, protein's 4 grams, carbs are going to be 4 grams, and fats are going to be 9 grams for 1 gram. So with protein, we know there's a high thermic effect with consuming protein, which means it's going to start boosting your metabolism when you start to eat protein. And there's a lot of misconceptions about eating more when it comes to losing weight. And that's, I think, a concept that not many people have grasped onto, and especially in women who feel like, number one, they don't want to eat more because they think they'll lose or they'll gain weight. But not only that, they don't want to look bulky or more muscular. And I can understand that, but unfortunately that's a myth, and that is a misconception. And so with understanding how to boost metabolism, protein is a great way to get there. It has a great thermic effect. It's going to start churning that engine of yours into an energy burning machine. Because in order to do that, to put on muscle, you need to have a good metabolism. That needs to have a turnover. You need to start turning muscle tissue over in order to build more. So protein, super important. Even just day to day, I highly recommend consuming a good amount of protein. This is just aside from growing muscle mass. I would say in adults between 80 and 100 grams is something you should shoot for just day to day. If you're going to grow, the typical standard is between 1.2 to 1.7 grams per body weight pound. So I'm 140 pounds. I'd want to shoot for maybe that 150 to 160. You can absolutely do more. Bodybuilders, they do sometimes upwards of 2. Obviously cautious with there, but not many people are going to be doing that, right? This is just for those who want to put on 5 to 10 pounds right now in the next few months, maybe half a year. That's where you're going to want to stick to. Any more than that can be overkill. The kidneys can only filter through so much protein anyway, so you're going to be urinating that out after. So 1.2 to 1.7, and then that's when we start to see a good amounts of muscle mass growth due to protein. The last thing I think to bring up, if you are injured, one of the biggest things that can actually improve your injury outcomes is eating more protein. Studies have shown once you start to increase your protein during injury, you're going to have more adequate healing and turnover of celebratory changes in healing. So protein, it's a beautiful, beautiful macro. It's definitely one that is going to be crucial with muscle growth, and it's very important to make sure you're hitting adequate protein intake during growth, for sure.
Doc, going on that point, when you're looking at protein, what are certain things that you look at in terms of how to calculate the amount of grams? Is there like a dimension you use? Where I've heard the fist in terms of like a meat slab before. What are some of the things that you look at?
If you want to jump into the more specific ways to measure, it's definitely going to be more effective. These are things like a weight scale where you can weigh your food. Once you put your food on the scale, you can Google what so many grams of one food contain per protein. So just in general, if you have an idea of how much protein is in this amount of food, for example, in about 6 ounces of chicken, which is about, like Doc was saying, it's about a palm full, it's right around 30 grams, I believe. So that's a way where you can get just an idea, which is helpful if you kind of want to loosely track your macros. If you're looking to, by all means, be efficient with your time and making sure that you are getting the results in the shortest amount of time, a weight scale is a great way to do that. But there are many places on Google where you can look up what a certain size of this meat and what amount of protein is in it, which I think is a great place to get started to just, over time, like I already have a lot of these things memorized. I know a steak is about 30 to 50 grams depending its size. Chicken is about the 30 area, turkey's a little more because it's leaner. These are just things that you're going to pick up, obviously, once you start practicing and just knowing. You do this for a week and you maybe even have a journal. You're going to remember your macros pretty quickly because we're creatures of habit. We pretty much eat the same thing almost every day depending on variety. So that'll continue to be a lot easier for you as you continue to practice it. Moving down from protein, we're gonna jump into carbohydrates. Carbs are a loaded macro topic. I feel like that's one another that there's a lot of misconception about carbohydrates. Right now, I can't believe I think I saw this the other day. 70% of the carbohydrates marketed to the United States are the ultra-processed carbohydrates. And we all know that is what we're trying to avoid when it comes to carbs. It's the processed carbs, ultra-processed carbs. We know that they are a pivotal source of why disease is growing in this economy. It's not because red meat is giving you heart attacks. It's not because butter is the enemy. It's ultra-processed carbs are very, very detrimental to insulin resistance and a lot of other things we'll probably get to in a later podcast. But just hitting on carbs, here are some of the main things that you need to know. So with carbohydrates, they are an incredible energy source for your body, especially when you are doing high impact or high resistance training. So those are what's going to be crucial for making sure that you have the energy to perform and making sure that you can recover once you're done with that. And so post-carbohydrate Replenishment is crucial to replenish the glycogen stores that you just ended up using during your workout. Mixing protein with carbs is another crucial way to continue to build muscle, continue to have the right amount of energy to build muscle for protein synthesis. Very, very important. Carbs, again, 4 calories per 1 gram. So it's the exact same as protein. And yeah, really carbs, there's a lot of misconceptions because a lot of people feel that carbs are what boost weight growth or fat growth. Yeah. And yes, over time, eating poor sources of carbohydrates and continuing to rely on those poorer sources, do have a correlation and impact with reducing your ability to have proper insulin sensitivity, and you're going to put adipose on. And yes, it's not the most effective way to keep your weight where you want it, but what people don't realize is the complex carbohydrates that come from vegetables, they don't impact you that way at all. In fact, it's incredibly valuable to continue to eat those kinds of things too when you're on a bulk. A lot of people, they just hit the things that are going to give them energy and they're going to give them a boost, which is usually it's going to be chicken and rice, right? Rice is not the most nutritious carb. It's a whole food carb, but it's really just there for packing on pounds and giving you energy, especially if you're going to be in the gym. But the nutrition portion of vegetables and the complex carbs that come from it are still very valuable. The fiber that's coming from it is going to improve a lot of the gut biota that you have. It's going to clean your intestines. There are things that you definitely need to include in your diet, especially when you're putting on weight or you are changing your diet. So I just want to make sure I hit on all of that, Doc.
Oh, that's perfect. Now, in terms of the roles of fats,
Yep.
Now a lot of this you'll see labels like low fat.
Yep.
Fats are actually really important, not excessive amount, but Doc, I love your input on what are the proper fat intakes and why is it so important?
Absolutely. So fat, we always correlate to what's on our body. So there are huge speculations when it comes to consuming fat, carbs. There's just a lot of misinformation out there, and that's probably going to be a podcast in and itself. Understanding your diet and understanding really what you should be consuming and how to not avoid fat. There's a lot of body dysmorphia, diet, eating habit changes people are going through, anorexia, bulimia. These are things that there's a lot of fear when it comes to consuming food. And so the simpler you can keep it, I think is better. And so fats are essential, people. Like, they are essential with improving your hormones. Fats are what can improve and create proper hormone growth. Testosterone is essential. You need to consume fats in order to have proper testosterone replenishment and enhancement. So that is exactly what is going to help change your metabolic activity, change the ability to put mass on, especially muscle. Testosterone is crucial for that. Both men and women have testosterone. Yes. So that there needs to be adequate values of both, not just for men. I know men usually will correlate testosterone in men, but women do absolutely need it too. And when those levels drop in women, you do notice changes. There's a smaller amount of it needed in women, but it's still crucial for them to have proper adequate testosterone. So no, fats, very crucial for hormone. The thing with fats is it's 9 calories per 1 gram. So this is almost double the other two. So fats are your foundation for probably putting weight on if you don't want to eat so much. Because that's another thing is when you can sneak fats in, healthier fats into the diet, you're not sitting there and eating so much to get to your calorie surplus. So they are the backbone of the diet, assuming you are eating a good healthy fat. Healthy fat being having avocados, grass-fed butter, and there are plenty of other healthy fats that you can get into your diet. So lastly, when it comes to fats, they're your low burning energy, but they're going to keep you energized throughout that consistent portion, especially during maybe lower to moderate activities. Your body is going to burn that glucose first, those carbs first, and then it's going to want fat right at the end of it, especially if you don't have any glycogen left. Let's say let's say you're on like an 18-hour hike. You've probably burned your glycogen storage, and now it's your fats that are jumping in to help pick up where there's no more glucose. So that's fats in a nutshell. they are super important. Eating fat does not make you fat, which is, again, another topic down the road. But those are the macros when it comes to consuming food and understanding the calorie surplus or deficit if needed if you're going to change weight progression.
And Doc, going into fat size versus muscle growth size, because we hear this every now and then to where muscle sinks and fat floats. So just speaking on that aspect in terms of the size between those two, I guess, where are the differences?
For sure. And, you know, you've ever seen those pictures where does 1,000 pounds of bricks weigh more than 1,000 pounds of feathers? And it's supposed to trick you up.
Yes.
But no, it's the same weight, no matter what. They put the picture to be the same size as the brick, but no, they're the exact same size. I should say a pound of fat is the same as a pound of muscle. Now, it might be different in what it looks like as far as size, but it is the exact same. So what you'll find is if you start working out, let's say you are working out with cardio and weight resistance training. There's a good chance you're putting on muscle, especially if you're eating good protein. You're probably going to lose fat too. So increase muscle, decrease fat. You get on that scale after 2 weeks and it hasn't changed that much. However, if you are taking before and after photos, you might find you look better. And that's exactly what happens. We have discrepancies in gaining and losing, especially if we are going to jump right into this. So there are times where you shouldn't be discouraged in the beginning, because if you do put muscle on and reduce fat, that weight scale might not change right away in the beginning. So there are also times where you might work out for 6 months and what you expected to lose was not as much as you probably wanted to, but you look way different because you are toned, and a lot of the visual effects of what we think as far as looking and losing weight, it doesn't necessarily come in just 6 months. So what you need to know is fat versus muscle. If there is 1 pound of one versus the other, it's still going to weigh the same. Now, when it comes to breaking down fats, you need to understand this. We don't necessarily lose fat. We don't necessarily get rid of fat in a way. Think of it like this. We have a fat cell. It's called an adipocyte. So we have an adipocyte, and it is full of triglycerides, and that amount of size of the cell is going to be impacted by how many triglycerides we're storing. So if you eat poorly, you don't move, your body's going to continue to create triglycerides, and that cell is going to swell. The swelling is going to come with you gaining size, correct? So men tend to store fat more in their abdomen, women tend to store it more in their thighs and their hips. And there will come a time where you just can't store any more triglycerides into these fat cells, and it'll leak out, which will come then inflammation of organs. It'll start seeping into your organs. You're going to get fatty liver. You're going to have insulin issues with your pancreas. That is what happens once there's no more fat to store. So reverse now. We're at this point. We have storage in these cells. Your body is going to start tapping into those triglycerides if you continue to move and exercise and do training. It's going to take from that, it's going to burn it as energy, which once you take a triglyceride, you break it down into a fatty acid and a glycerol, glycerol being your sugar molecule, and that is what's going to allow it to burn, to give you energy as you continue to do things. When you burn more and more, that fat cell shrinks and shrinks and shrinks, but it doesn't go away. You don't get rid of it. So when you burn fat, it's not necessarily burning and getting rid of it as if you were to put a log into the fire and it come up as ash, right? It's shrinking and it's gaining size necessarily. So when it comes to the shrinking portion of it, you might also be losing water weight at the same time. There are times where I've had patients go on weight loss diets and they lose circumference. They lose size. We measure them, but they don't lose as much weight as they thought on the scale.
Yes.
Because they lost the fat, but they gained muscle because they were working out too. So there are a lot of things that you need to be understanding of when jumping into something like this, especially if you're looking to grow muscle and to lose weight.
And then just to touch on that point, when also you want to tap into those energy stores to get rid of the fats, in terms of exercise order, that also matters well. So like if you're going to work on building up tissue or growing muscle, you want to end with cardio at the end. So you have already depleted certain energy stores, and now you just want to get some of the fat storage at the end of the workout. Very important.
Tap into it, right?
Yes.
Deplete that glycogen, tap into the fat.
Yes.
Yeah, good point.
I'm curious to see how hormones and the gender differences play into.
Yeah, so that's definitely it on fat. With hormones, we know that there is drastic difference between hormonal values, what kinds of hormones are in values of a woman versus a man. I think the two biggest ones that I think we can very easily bring up is estrogen versus testosterone, especially in a man or a woman. So with testosterone, that is already going to be an anabolic hormone. Its job is to drive metabolism and to improve repair and breakdown of tissue, especially muscle being one of them. Estrogen gives the ability to store more. It wants you to store. It wants you to help retain. So with estrogen, women already are at a little bit of a disadvantage if they are trying to grow a bunch of muscle tissue, because they're fighting estrogen, which is trying to help store fat, especially if you're going to be bearing a child. That's what your brain assumes you're going to be doing. So for just that alone, there's going to be some discrepancies between hormones. However, when it comes to putting on muscle, when it comes to gaining strength in the gym, strength training is still important for both men and women. Men and women absolutely should be doing strength training for multiple reasons, one for the other. Men, it's incredibly valuable to keep muscle mass on, to grow muscle mass, because it's going to improve that cyclical testosterone loop. You want to continue to have high amounts of testosterone. One of the best ways to improve testosterone boost is actually squatting. Your thighs are directly feeded into your testosterone production, and so that is crucial for women. Testosterone still is important, but with strength training, we talk a lot about, especially in practice, Doc, osteoporosis, and making sure that we can limit the detrimental effects of bone demineralization. So strength training is a weight-bearing exercise, is what can help build bone, can help keep bone on so you're not losing it. So especially as we get older, we talk about fall risk, we talk about fractures, all the kinds of things that we don't want. Weight training in women is essential, it's crucial, absolutely crucial.
Absolutely. But I'm curious in terms of like ACL injuries, because I know you looked at a study on that one.
Yeah, for sure.
What was your input on that one?
So when it comes to we're kind of the basis of differences between men and women. There was discrepancies in a lot of the literature too. There are some that if you Google right away and you'll say, what injuries do men have more than women, and vice versa, you're going to get a lot of information. But the ones that I looked at showed the difference between sex discrepancies and no sex discrepancies between injuries. And the best one that I could find, and this was done in 2022, a lot of the research that I think is quoted out there is done from prior. So this is a pretty recent study. What they found was there wasn't as many sex discrepancy injuries as we thought. We used to think that women get concussed more. They used to have a lot more injuries per body part than men. There were a lot of things out there. However, the study truly did take a good look at the data, and it showed the weighted average between women's sports and just how many are in sports compared to men. And then they took a look and really saw the difference of injury in one category versus the other. And they made sure that it was statistically significant too. And they made sure that the difference was enough to call it significant. So they did find that women in most sports would have more ACL injuries than men. And why is that? They did have a great point. And it's in the anatomy of women, the space around the ACL is actually smaller than in men. I don't know why. That might be an evolutionary. I really don't.
Larger Q angle, maybe?
Well, that's a good point, right? And that is something that I'm going to be bringing up pretty soon here. But we have women who have wider hips. Doc was saying he's talking QL angle. That's where the hips are wider so that the angle down to the knees is at a wider angle versus men have narrower pelvises, so there's less of an angle down to the knee. And that might be too, but smaller around the ACL causing less space for it to move, or there's a higher chance that it might tear. So for sure in women that was a higher correlation. But when they looked at men, they found that just overall men get injured more than women. And that used to be, women used to get injured more than men. That was the narrative. So no, they found overall men have more injuries. They also have a tendency to have more pelvic, hip, and groin injuries. Again, whether that's pelvic anatomy, whether that's just, I really don't know. I have no idea. But that was just the study that they showed. So there definitely is differences there when it comes to injury. I do know that looking back, there are times where you might have anecdotal evidence of, I run a clinic where you have many athletes or sports injuries coming in, and you're like, I see so many more of this, or I see so many more of this in men and women, and it's like that isn't necessarily good quantitative information. And I know that there are times where you think you see more of one than the other, but when you take a look at the actual retrospective data on everything, there isn't much discrepancy between that data. So that's what I found when it came to that.
That's fascinating.
Yeah. So we broke down pretty much everything that comes with the nutritional foundation to building tissue. Mm-hmm. Now let's say we are actually in that gym or we are training. There needs to be, like we had talked about before, efficient ways to do this because we only have a finite amount of regenerative times to be able to do it. Mm-hmm. And as you know, nobody wants to be in that gym longer than they want to, unless you are just a gymaholic. But for the many of you that are probably watching, you're like, all right, what do I got to do to put muscle on and in the shortest amount of time possible? So Doc, as you jump into training these tissues, I know that you have a great amount of resources as far as the best movements for each area and certain workouts. So if you just want to first just kind of jump into understanding how or why someone would want to move the way that they do and what gain or yield are they going to be getting from these kinds of movements.
Oh, that's beautiful. Yeah. So whenever you look at movements, you have to take in consideration where are you shooting towards, where is your goals, whether that's a certain sport, whether that's a certain rehab of an injury that you've had in previous, which we'll get to in here in a sec. When we look at what goals you have, like let's say there's an average Joe, we want to make sure we're healthy, make sure that we're being able to either play with our kids on the ground, go out, explore, hike, move, whatnot, pain-free, regardless of what your goal is. You have to understand the structures that are being involved. We're at a point right now where we can train certain muscle fiber types. That's where not only muscles, but also ligaments and tendons, also joints, and how all those come together on a local basis in terms of either just your wrist or just your elbow and bicep, tricep, wrist flexors, extenders, but also in a global standpoint of how everything kind of moves and functions as a whole. Now, going back to the point I made earlier, in terms of joints are the first signal to the brain. And if there's any problem with that, it's going to cause overlying muscle guarding, tightness, and then lead to compensations throughout. So when you look at training muscles, the movement types with that one are concentric movements and eccentric movements. It's allowing the actin myosin to come together and relax apart. Now, in terms of bleeding muscle contraction energy or tissue contraction energy into the ligaments and tendons, that has to be done in a specific way. So when you look at training those types, a lot of that is through eccentric formation, and that is where we found a lot of the literature in terms of like the Elferson protocol, to where they looked at Achilles injuries and how you can rehab tendinosis and tendinitis problems. A lot of that was through longer lengthening or slowly depressing the heel as it goes down, and it helps rehab the injury much quicker. And even if you slowly start to lengthen over time, you can feel where the energy is. It's going to be at the elbow joint or where the joints are lengthening more so than the muscle belly. So we can bleed that energy into those structures. Let's say there's ligaments that have been blown off. Ligament is attachment of bone to bone, to where tendon is bone to muscle. Now, there's certain aspects with that in terms of bleeding the muscle contraction energy to the ligaments, and that's through isometric contraction. So the tissue has to be at length so we can create that tensile force. And then from there, you bleed a muscle contraction energy into the wall, off the wall, but you have to watch the variety of intensities. So when we look at training muscles different than ligaments and tendons, different than joints, all those have to be trained differently. The fascinating part is you can actually train joints. And how you train those is by moving through the biggest range of motion anatomically that any human can possibly move in, and it can be very specific to that individual. It has to be taught so a person can understand how everything functions as a whole, and this can also be assessment on a daily basis, weekly basis. This is in terms of workspaces, or how well can you move throughout your workspace for each and every joint. This has also been known as controlled articular rotations, or CARs. Same thing. Now, going back to the signal, when we're looking at assessment of the body and how you can retrain the joints, as you're moving through the biggest range of motion possible, it's allowing the joint capsule to pick up and redispose of the waste products over time, which will help maintain the improved range of motion. In our clinic now, we have people do workspaces and train joints more for the signaling purposes, but also for the rehab of pain, of healing injuries, and also for the signaling of tissues. So again, to train the joints, you want to move the joint through the biggest range of motion possible, both directions, pain-free, especially not moving into sharp pain. Sharp pain is either pinching off the joints, which will then pinch the nerves and cause more of a pain adaptation, or you have loose, sloppy space, often comes where you're incredibly flexible, whether that's dancers, gymnastics, and you have to be able to control that range of motion and not just be able to put yourself in that range of motion. So more or less, like, are you able to do the splits? If so, well, why can't you kick your leg straight up in the air in a straight line? Because you don't have the actual muscle tension to control that energy to move that leg up and control it and hold there. Some people do, but that's where you have to have proper control of the capsule, the tissues around it, and the proper supporting structures. So that's something I think incredibly important. A couple other topics that we want to bring in. The law of entropy, and this comes with the body naturally degrades over time. If you're not rebuilding or building up tissue, the body wants to send resources to use what it's accustomed to. Bodies and humans are more or less more lazy. I'm not saying that to you specifically, but as a whole, if you don't use it, you lose it, and that premise takes control with every type of movement that you go. So if you're not building up tissues, if you're not moving the joints to the fullest range of motion, it's not going to send resources to keep those ranges. It's going to send resources to build and allow you to move in the direction and the movements that you've been training. That's where we know that forces are the main signaling to any type of tissues, and that often comes in via muscle contractions. Now, you can passively move into certain positions, whether it's static holds, but you can't necessarily control those positions. So as we're going to stretching motions, you want to apply a muscle contraction to and from the stretch, thus so you can control that. So those are just a couple small points that I kind of want to bring up. In terms of training from a year-long scale or a macro scale, when people start off by training, when people start off by trying to lose weight, trying to get healthier, exercise more, I think it's important to know that you have to have the right cardio, you have to have the metabolic function to do some of these movements. So you want to build up some of the cardio aspects, you want to work out certain muscles, whether that's high reps or a lot amount of repetitions with low weights, low load, whether it's body weights, full body movements, and you want that for probably a few months and build that up. From there, you want to lay down and grow the muscle size and the tissue size. So that usually comes in hypertrophy training. So you want to have the intensity range anywhere from 30 to 80%, 30 to 90%, and that's based on what 1 rep max. In terms of intensities, let me back up a little bit. There's only so many ways in terms of how you can train the body. A lot of it depends on the amount of energy you can muster, either load against time or in certain positions against gravity. Look at it in terms of how much intensity, how much weight do I have to move, how strong do I have to be to function in this position, and for how much time, and for how many reps. And that tells the body the center resources to build up the tissues and to build up the resources to store, and so you can go into that function and to those movements. So going back to the cardio aspect and going back to the high reps, low weight, so you can build up the function of going into and rebuilding the body. From there, you want to go into hypertrophy training. From there, you can look to go to strength training. Now, the difference from hypertrophy to strength training is less of the reps and more of the amount of intensity load that you have to go into to either move certain objects or to complete certain tasks. And then from there, that strength that is then gained can be put into power or speed, which speed is the same thing as strength, but in terms of a different aspect of what's called force, lengthening curve, if we will, to where how much stress can you or certain tissues go through before they yield out or before injury. And I'm going to get to injury here in a second, but each muscle fiber type also has a stress strain curve or force tension curve to where it can only handle so much. So going back to the point on like the sliding filament theory, if we're not training it with rotational movement, if we're not training in certain areas where there's common injuries that could occur, oftentimes you're putting yourself in an increased risk that injury could occur, whether it's just even bending down and tying your shoe. If you don't build up the tissues around it, they're going to yield to force against gravity, and then they're just going to blow out, and then everything's just going to guard from there, and then compensation factors take in.
And a lot of that too, when you had mentioned the bending over, that's just due to no conditioning at all in those tissues. Yes. Probably there's a lot of weakness in those tissues too. And all with patients with herniated discs or any type of things we see, it wasn't because that thing was, perfectly healthy and then blew right out. There was a poor conditioning loop down until the straw broke the camel's back kind of thing, where you just did not have great stability around that joint. And once you bent over that final straw, there was just not enough conditioned tissue to kind of protect the joint, like you say.
Absolutely.
And so, yeah, that's interesting.
So when you look at the macro scale, how you want to build up the workout order that you want for that day or even for that week, where you want to have your energy systems filtered, it depends on goals and what you want to achieve, but then also in terms of maximizing the workout it takes to build up. Regardless, you want to end with cardio so you can deplete certain energy systems. Yes. And if you put cardio at the beginning, it's going to deplete other energy systems where you're not going to be able to get as much out of the muscle pump, much out of the hypertrophy strength training that you want. So the order is also very important, but the huge key takeaway for most individuals is be putting the cardio at the end. Like you can warm up on a treadmill if you'd like. It all depends on what tissues are going to be functioning and performing at that time. When I look at in terms of workouts for the day, let's say I want to do chest day, upper back, or push-pull movement. What structures are involved? Well, we know that the shoulder joint is, we know elbow, the wrist joint, and then also the grip strength. We know that the muscles of the pecs, bicep, tricep, wrist flexors, extenders, they're all are going to be involved. So in order to go into the workout, a lot of people just warm up with light sets and they patternize certain movements, which is, it's fine, but you can only patternize certain movements for so long. And not to say patronizing movements is a bad thing. Like when we're looking at retraining gait training or how people can walk, patternized training is incredibly important. It is immensely important. And I know, Doc, you definitely take a huge specialty on that, and you brought in such a wealth of knowledge to not only the clinic, but our patients as well. So I just want to say thank you for that.
Yeah, of course.
We're looking at patternizing certain common movements that we do over a period of time. Like if we want to build up tissues of our pecs, chest muscles, that's great. But if the muscles overpower the connective tissue of the ligaments and tendons, they're going to yield out to where if you're training properly, if you're training for years on end, 30 years, you should be able to move a lot of weight. But if you can't move a lot of weight, why is that? A lot of it comes from injuries. And why do injuries occur? Oftentimes, like I said, the muscles will overpower the connective tissue or joints, and then they yield out, and then you're rehabbing and you go backwards and decline the muscles. So when we're looking at training, we want to train the joints, the shoulder joint, elbow joint, wrist joint, the spine, the joints of the neck, mid-back, lower back. You're going to get more of your pump as well, just even by that. And in terms of motor units of how the brain nervous system signals to the tissues, if you can warm up the main precursor of how the joints signal to the brain, that's going to allow more neural input, so you are able to output more energy, able to output more strength, endurance, and all that. So when I'm looking at warming up for the day, I want to go through the workspaces of how I can train the joints. I want to do light, low lengthening of the tissues in multiple directions, so my body is able to withstand the force against the movement of the bench press, of the lat pull down, of the pull up. So you want to do the same thing whole scan prior to, in terms of warm up for each body system. Now, in terms of how to train certain areas, I'll go into specifics. In terms of training the long duration cardio, which is important to train ventricular hypertrophy, of how the heart can pump out more blood to the body. That's one of the main purposes of cardio work, is for the vascular system. So when we're training long duration cardio, whether that's bike, whether that's a run, a jog, a walk, a rower, elliptical, any bout of exercise movement that you can do for a longer period of time, that you want to do probably either one session, it could be 3 times a week if that's what your goal is to run a marathon. But in terms of general maintenance, once you build that up, if you go at that 2-3 times a week, you're going to be seeing pretty good. But if you want to maintain that cardio level, in terms of retraining aspects, whether it's 30 days plus or minus 5, depending on individual, you can do that same cardio session and still maintain certain aspects of the vasculature system, of how your body can output and how conditioned you can be. Now, in terms of hypertrophy, where the focus is the quality of the contraction coming to concentrically and also lengthening eccentrically, you're going to get more out of it going through the fullest range of motion, multiple reps, and then working at the intensity anywhere from 30 to 85%. You can go more in terms of drop sets, or you do like 15 reps, then 12 reps, then 10 reps, then 8, and then you go all the way down from there, just to bleed out the system. In terms of rep range, you want anywhere from 6 to 30 reps per set. And in terms of sets per week, per muscle group, anywhere from 3 to 20 will help build up the tissues. Now, the rest between the sets, you want anywhere from 30 seconds to 3 minutes. Just so it allows waste products coming out, blood coming to, the amount of energy that your nervous system has to drive up to move that weight to have it relax, and for hormones to re-regulate itself. Now, in terms of strength training, similar aspect, but we just work on 3 to 6 sets per week per muscle group. It's just higher demand for the tissues at that time, to where then you want to lower the rep range from 1 to 7 reps per set. Now, the rest for that is going to increase to 2 to 5 minutes per set. And then as we go through into aerobic endurance or anaerobic endurance, and that a lot of it depends on what the goal is, like I said, but all this is a variation of intensities for a period of time against load against gravity, which if you have a certain ratio, it's going to help more towards aerobic endurance or anaerobic endurance or conditioned cardio or strength, hypertrophy training. These are all just words and names based on a certain amount of work done over time against load. A lot of it's broken down that simple. And then when we get into speed, power, that's a lot of it's focused on how quickly can you move a load, how quickly can you move your body, and for how long, for what position against gravity over time, cuts, angles, walking backwards, forwards to the side. It doesn't matter too much. It's more understanding the premise and how you want to train it.
I like you said, we're going to go into that. They're going to have resources available. Just a couple things that sparked my questions, and those of you out there might have the same. Why would someone maybe want to do the difference? You had mentioned the difference between, I believe it was reps of 3 to 20. It's kind of a vast range. So where would you have like discrepancies in using so many sets, so many reps? Is it, do you start, my guess is you kind of start off slow, you move up, or do you want to start with more reps, less weight? Like, where's the differences and why you would use one or the other?
Good question. So with this, a lot of it will probably come down to time in terms of how much training you can do per week.
Okay.
With us being busy, that's where is the minimal amount of signal that your body can accrue to get what you want out of it. In terms of 3 sets versus 20 sets, if you're trying to gain a lot of muscle, if you're trying to increase the size and the diameter of that myosin, of that muscle belly, and or the swelling fluid retention within that muscle, your body needs a certain amount of load coming in. So like, let's say if you want to create that bottom threshold of 3 sets per week, that's per muscle group. So that whether that's working push-pull movements of your upper back, whether it's a front side, back side, or whether it's legs, whether it's calves, ankles, that also has to be factored into it as well, which is why a lot of times people break down workout sessions of upper body Monday, Tuesday, it's your legs, Wednesday off, Thursday, different part of the body. It's how well you can recover, heal the body, but also at the same time put the amount of stress and load so you can build up the systems.
What's a good place for a healthy 20 to 30 year old they could probably get away with starting with? Where would you, and I know it's probably different per person, but just where do you think they would kind of get started on?
That's a really good question. I'd say any type of, if you're starting off with working out, if this is something new to you, you want to go more of a global fashion. If you've had, and what I mean by that is doing full body movements, whether that's burpees, whether it's push-ups, whether it's squats, side lunges. If you spend more time and if you have more of experience at the gym, then you can break down certain other tissues involved, whether that's just working on your wrist flexors, extenders, building up your forearms and grip strength, whether that's push-pull movements of your upper back, shoulders, arms, back. That all depends on, again, back to the goals aspect, but whatever time you're willing to put in, you'll get more out of it.
For sure. And that's, I think most definitely understand that. Starting off, you're gonna don't push yourself to that point of injury. That's the whole reason we're doing this today. I know January 1st hit and you guys are ready to make some changes, and we're happy for you and we hope you do. But again, the whole point of episode 1, getting you to that year point, not stopping your journey at month 2 because you had an injury, right? We definitely aren't looking for that. So this is just so that you guys can get started appropriately and maintain that through a great trajectory towards the end of the year and even into next year. That's really why we're trying to get that. So that's a great point, Doc. Absolutely. With training, Doc, I mean, there are definitely different systems when it comes to the endurance portion of things, cardio things, strength and speed. Do you maybe want to really kind of dive into the specificities of all that? I know you're going to get to that. I think there's a lot of people that are ready to kind of step into this with a little bit more specificity. Me being one of them, I'm ready to learn today too. So if you want to just kind of jump into that too.
So in terms of training certain systems, the body will adapt to whatever demand it's placed upon. So when we're performing energy outputs or working on or exercising, there's a metabolic function, there's an endocrine function that also comes with that, and a lot of that depends on the intensity that your body goes into and how much energy output you can muster up for that movement. So when we're looking at in terms of training certain systems. For example, going back to the conditioning of the heart and how well blood going to the tissues, the body, and back up. On a cellular level, that's going to increase more aspects of capillary beds laying down. It's going to allow more oxygen and CO2 or waste products coming and filtered out, which then you breathe out the CO2. Thus, the carbons that were in the tissues, especially in fat cells, they can get mustered out via the breath. Not to necessarily go down the rabbit hole, but if you want to help on the weight loss aspect, doing breathing prior and after is going to be incredibly important. And also even for the recovery rate, after performing a high amount of exercise or energy, whether it's for that training session itself or for that set of bout of exercise, the sooner and faster you can get your heart rate back to level in terms of homeostasis, the better your body's going to adapt over time, and it's going to have better utilization of sending resources to certain areas to build up, to improve, to adapt.
And you're saying breath work is obviously a great way to do that.
Yes.
Or get your heart rate back. That's awesome, actually. That's super cool. I didn't even know that. I'm sure we can get into breath work at another podcast too.
Yes.
But no, that's awesome.
Now going back into like the energy systems and control, when you look at the nervous system and how it fires to certain muscles and for the rate, for how long, like when we're building up the speed aspect or the aerobic conditioning, we're looking at the nervous system signaling in terms of the reps, in terms of the efficiency of how the body can move. When you look at marathon runners, for example, Kenya, you can see those individuals are very, very good at that oxygen, CO2 exchange. They're very good on the muscle and skeletal level of how they can redisperse resources to the area and then out of the area. Compared to someone, whether it's in America or Scandinavia, and their body weren't necessarily adapted towards that, or someone that, let's say a Native American that grew up in their homeland for generations upon decades and hundreds of thousands of years, that they came from somewhere more cold to where they have more adipose tissue storages, especially more brown fat storages. So you have to look at it in terms of your evolutionary basis, and you can find a lot of these, whether it's 23andMe, Ancestry.com, so you can kind of see where some of your heritage came from, so you have a good understanding of what is my body acclimated to on a DNA level. Not saying that you can't change or adapt, and certain people are more apt to improve function, especially via the same environment versus others, and that's just how the human race has evolved over time, but it all depends on what you want.
And genetics too, right? Obviously, there's a good chance 2 Olympians that breed are going to have a pretty decent chance of having an Olympian offspring versus 2 that didn't make it into the Olympics. Not to say that that person doesn't have a chance, but it's what the body has been acclimated to, not only environmental, but just stressors of resistance of training and cardio. Those are huge imprints into DNA, and it does make a difference over time. So absolutely.
Yeah, and I think that this is for another conversation, but the environmental factors of how someone can adapt has more of an impact than genetic factors. The composition of individuals are predisposed to have more fat storages, are predisposed to have other conditions on the genetic level versus others that might not have to work as hard to have the same goal. But even though each person has the equal amount of right towards a healthier or better version of themselves, certain people have to work harder or less hard depending on what they were given genetic wise.
But you were saying you were going to jump into the fact that environment has usually a bigger impact than genetics. That's interesting. Yeah, we got to jump into that for sure.
That's probably a whole comment itself.
That's awesome.
There's a lot of stuff with that, and again, a lot of it comes back to goal dependence as well too.
Of course.
So now, Doc, there's one aspect that I want to touch on that I kind of tiptoed around, and that's retraining. So let's say you're a workout buff, you've been in the gym, you've accrued all this muscle tissue, and you want to maintain. You don't want to build up anymore. You want to use your time towards something else, whether it's financial, personal, what have you with that, you can keep the tissues that you grew over a period of time, and that's going to retraining. So for example, for cardio work, for strength work, for speed work, those also have to be trained within a certain amount of period of time, but at the same intensity. So for example, for people that want to maintain cardio or long duration cardio, going back to what I said, train 30 days plus or minus 5, so anywhere from 20 to 35 days, you can retrain at that level and maintain those tissues. Or if it's max strength work, that's again, same thing, 30 days plus or minus 5. For speed, however, especially for athletes, this is where you have to work on this ideally on a weekly basis. So you can lose your top end speed over a period of time, and that's based on the efficiency of the resources coming in, coming out, kind of like I said, either long duration or even sprinting wise. It's just different energy systems throughout the body that's being utilized. But that speed has to be trained every, let's say, 3 to 8 days, depending on the person, or so you start to see diminishing effects over that. So that is something.
So you're saying if you have muscle put on, you want to keep it, you haven't been able to get to the gym the 5-6 days a week, so you're trying to push. It's about 25 to 35 days you can not train to worry about losing any gains you have.
Yes.
That's interesting.
Yes.
Okay.
So either that's scheduling out on your everyday life, like this week or this day I want to maintain my strength gain, so I'm going to focus on, and this is for each tissue, I want to focus on maintaining my max strength. So you want to utilize higher amounts of intensity, anywhere from like 80 to 100%. Again, this is for max strength. And you want to go in and work those tissues, warm up the joints, the connective tissue, muscles, and then go into that session. And then that can maintain you for another plus or minus 20 to 35 days, and then you can schedule that out next month.
That's crazy. That's helpful.
Yeah.
And I think a lot of people are, I know I'm one that I've gotten to that point where, man, I was in the gym that 10, 12 months, did great, 5, 6, and the next thing you know, life hit and I had way more things on my mind. But if I could at least still just keep up maybe weekly to, like you said, that 25 to 35 day mark, until I can get my schedule back in order, that changes a lot. I think a lot of people are going to be interested in hearing about that.
You have to put the work in to build up that baseline, certain energy systems that are involved, the adaptation, and then what specific training is involved. It all depends on maintaining, but then specifically working towards what your goals are, and a lot of this will come down to athletes. But if you just want to maintain general health after you built it up for a period of time, just scheduling that out 1 week every month or so would probably be ideal.
Yeah. And I know a lot of you out there are probably thinking, I want to grow muscle, I gotta work out. But I think what's important too, and I know Doc is going to hit on this in a little bit, is there is so much more to exercise and working out than growing muscle. The residual effects are limitless. I mean, truly, there are so many different things that you can get from working out every day other than just growing muscle. And I know that that's a big one aesthetically, right? We're always looking to look more toned and fit, but why you should be working out routinely other than just muscle mass? I mean, Doc, what are some of the things that people get from different types of training other than just growing muscle mass?
That's a really good point. Not only the appearance, but also the mental function.
Yeah.
I think that's something that gets missed so often, especially for students out there. For myself in grad school, getting through chiropractic school, it was so important for me to exercise before, from an hour to half hour before a test, not going super crazy, but that way allow blood exchange, allow certain neurons, transmitters to get active and functioning.
Yeah.
And that, once you build that up, those systems are still active for anywhere from a half hour to hour after your training bout. Yeah. So working out prior to exams are incredibly important on a mental side of things. In terms of how other systems of the body works and functions, whenever you move a limb, it's bringing waste products, especially in the legs, up and filters in the body, and then they can excrete from there. So it's going to have a huge effect on your whole body. But I think that mental component it's so important that not many people realize.
And I think a lot of people don't realize, and maybe you have seen the studies out there, but exercise alone can kill depression. I mean, just eliminate it. And I know for those of you who are in that gym or have been in the gym and for a consistent period of times, you remember what it feels like. That mental state of yours is different. You feel better. You are more aware and you have better clarity. I mean, the overall health effects of working out daily and striving and growing, killing your goals. The mental is, I think, where most of us get hooked to. It's, eventually you're going to probably hit a little bit of a plateau when it comes to growing muscle mass. There's going to be a limit for everyone. So you're going to get to that point, and where else you're going to then want to continue to focus on is just, what is this giving me? It's going to give you that mental boost and ability to get through your week, hit your stressors, eliminate the kinds of things that you have during the day, and just being the best version of yourself. So I know that when I started working out, man, it's night and day difference. Yeah.
And then even to take on the 360 side of things, like let's say we're working out every day, but now you start either plateauing, kind of like you said, or we start to get injured. And that's where, when you're looking at injuries are pretty much a mathematical equation, to where the load against either your body weight or against a certain position against gravity over time can only handle so much. So if your load exceeds your capacity of how the tissues can perform those activities, pretty much the tissues then yield to injury, and then everything guards, tightens. But let's say, for example, you want to build up or rehab an injury. You have to see what specifically is injured, what tissues are damaged, what structure is damaged, and then you have to see, okay, how can I rebuild that up? Do I have to rest, have it build up and have it heal properly? The problem with resting is once any injury occurs, the body is going to start laying down resources, tissues. Like once any injury occurs, you're up against a race against the clock of either it's going to lay down tissue that's either haphazardly laid down in terms of scar tissue. Once you have scar tissue, there's a lot of what's called pain fibers in that area. And until you rebuild and reroute some of those neurons, you have a higher tendency to have more pain with certain movements. That's also why when you get injured in one way, you have a much higher disposition to get re-injured in that exact same tissue. Now, when you rehab tissues, it's either, like I said, rest, but we're up against the clock. So what can you do to keep performing, keep moving in the right direction? Well, first off, what we can do is we can build up the capacity of the tissues that we have not either trained, whether that's lengthening of the ligaments and tendons, whether that's joint movement to rebuild up that joint space, thus allow less pressure and tension on the muscle system or less pressure on the ligaments and tendons. But usually how you want to start off with this is very light muscle contractions at length, pain-free. Even whether that's past after surgical cases, anywhere.
So let's say an elbow. Throw an elbow out there, doc. Someone's got tendonitis or just a bad elbow. They've been hitting that gym. What are the ways that they can obviously continue to stimulate that area without worrying about further injury?
Oh, that's beautiful. So first off, you want to move the elbow through the fullest range of motion first, whether that's having your arm completely at length, and then you want to see what you can move into pain-free. Okay. Pronation, supination. That's going to be starters. How you can bring the nervous system connection to the area. That's where you want isometric contraction, which is you contract the muscles without moving them. So just a light squeeze, anywhere from 10 to 25% over a week, 2 weeks or so. Once you notice less pain, increased range of motion, then you can slowly go at the lengthening process, or you start at one side pain-free and you slowly lengthen against time. All this ideally you want body weights, and then you can add light load and resistance against time.
How often are they doing this, doc, per day? With isometric versus eccentric once they start this protocol?
I would say as often as possible.
As often, okay.
but not to overdo it. So pay attention to the soreness, pay attention
Sure.
to the restriction. The skin, is it more warm than normal before exercise? Is there any swelling? Is there any bruising?
Sure.
If it's still persisting, back off the intensity, back off the range of motion, and then have it rest to heal. But throughout the day, I would go light contractions at length. If you can't get to length, or if your arm can't go fully straight, working on isometric contractions, like I said, pain-free in this position or this position. It's just, you want to start off with what you're able to do, allow the nervous system to connect to the tissues, and then you want movement from there.
Is soreness to be expected though, Doc?
Yes.
Okay, so where is maybe that threshold of, well, I am sore after doing it, but should I continue? Can I still push it? Where am I worrying more about that soreness versus I know it's going to be sore if I rehab it, but where's my my stop limit?
Whenever I hear the word soreness, oftentimes that is tissue adaptation. Like, let's say we have the injury to the elbow, and we don't know if it's improving, if we will. Going back to what we said, the right amount of soreness, if it's detrimental, if it's too sore to where it's unbearable to move or function out throughout your everyday life, or it's affecting your mental function at work, you probably want to die down the level of intensity, the work output, the amount of sets you're doing. And we see this a lot in people that are obsessed with either running or obsessed with working out, but they've reached that limit to where they're starting to get injured. That's where you have to die them down, either work on other aspects of the body, or you have to just be patient with oneself. And then we can go into heat versus cold. We can go into ice baths. We can go to the hyperbolic chamber, ozone therapy, get more oxygen to the area as well. There's a bunch of other areas of rehab modalities that you can utilize. Going back to topic on terms of injury prevention, to prevent an injury, again, like I said, it's either we're going to rest or we're going to build up the tissues. In order to build the capacity of the tissues, we have to start slowly, either lengthening ranges of motion, moving through the fullest range of motion, and then that's where you can build up the capacity of how those tissues can absorb force or load against gravity, so you can allow your body to go into risk mitigation depending on the position or sport that you have. So in terms of preventing an injury, it's hard to say that because the variability of life or certain situations that can occur that you may not trained in. But if you don't train in a specific way for a certain tissue, especially against a stress length curve, like let's say, for example, wrestlers, a lot of times they're put into a position to where they're either giving headlocks or trying to get out of position, to where, are you training this position for a period of time? Are you training the squeeze? And if so, is it a max contraction? Because if these tissues, if you're just doing bench press and lat pull downs and push-ups, you're building up the tissues, but you're not allowing the nervous system to control those tissues to where they're just going to yield out against time. So you have to be very, very specific to your training, but target the specific structures that are involved with the movement.
Yeah, and I think what a lot of people are thinking right now is, well, I'm not an athlete, so how does that pertain to me? But there are plenty of times where you might think about your job, especially if it's a manual labor job, right? And you're thinking, well, maybe I should start thinking about training how I work. And especially if you lift boxes, or if you are a construction worker who lifts certain things, you hammer. Would you say that is perfectly an important way for people to train if they're not an athlete?
Absolutely. And I love how you brought like the functional component of a person. When we're looking at patients that come in ourselves, we look at, okay, what is the position they sleep in? What is the work that they perform? Are they sitting for a period of time? Are they in a repetitive job to where they're a factory worker? They move something from here to here and over a lot of periods of time. And that's where you see, how can you not only manage the load of that, either the rotational movement, or like you said, the construction worker hammering nails, which maybe jackhammer knife, going up and down. So if you do like a job, let's say Monday through Friday, 5 days a week for 8 to 9 hours, with some breaks in between, those tissues are going to be overused quite often. So what are the lowest hanging fruit? What are the areas, systems that we haven't trained? How can we build that foundation so we can set upon different skill sets on that foundation? And skill sets, that might be certain aspects of your job. That might be even sitting. So for people that sit for longer periods of time, that are constantly in this position, that are knee bent, hips flexed, how can we either lengthen these tissues? How can we work the joints of those tissues, moving to the biggest range of motion possible? What are the other aspects involved with that position against gravity, so you can help take less pressure off the skeletal system and more on other tissues or other energy systems?
Beautiful. Oh yeah. And I think a lot of you, I know Doc first started out this podcast explaining skills as the first thing you want to be working on. So
yes.
I think going back through your day-to-day life and thinking, okay, what are some movements that I've noticed, maybe discrepancies in pain or other types of movements that just aren't where I would feel it's comfortable doing. Maybe putting a load of dishes up into that cabinet has been much more difficult. Those are skills that you can start with before you start working out, which is maybe moving a 5-pound dumbbell up and just working out. Would you is that what you would kind of say as far as the skill portion of things?
I would say so, yes. I think assessing what are your common movements throughout your everyday life, where are the common positions you find yourself in, not only at work, but also sleep, but also a lot of people, whether it's either bringing their kids to sporting events in the car, whether it's at the end of the day, they sit on the couch and watch TV. How can you change your environment to not be in that same position? How can you train other tissues?
Especially like a truck driver.
There? Yes.
Like a truck driver, right?
Gosh.
You can't. You are sitting there. I mean, it's not like they want to be sitting there without, feeling stiff and sore. So definitely training that environment, you're saying.
Yes,
yeah,
absolutely. Sure. Okay, that's awesome to have this knowledge, but what do I do with it? Well, I would suggest explore pain-free. So whether that's like, instead of sitting on the couch watching TV, maybe you start sitting on the ground, maybe you start crawling around, playing with your kids, playing with your pups. Regardless, that's one aspect. Second aspect, if we're trying to retrain certain movements or certain aspects of our job, what joints are being involved with that, especially desk computer workers? Yeah. How can I move my wrists to the biggest range of motion possible? Now, if you move into tightness, that's okay. You just don't want to move into sharp pain. Achy, dull tension, you want to monitor. Burning, numb pain, that's oftentimes a nerve impingement. You want to look to the spine, do a full assessment via a medical practitioner. How can I lengthen, go from short position to lengthening, wrist to lengthening, extension to lengthening, forward to backwards, backwards to forward. It's moving and exploring, but being smart about it. Again, key factor, pay attention to sharp pain. But that's where you want to explore, because your body is going to adapt to forces over time, and your body is then going to lead to less pain, less discomfort, greater range of motion, better quality of life. That's
better chance of gains too.
Oh.
Of course, right. Well, that's great. That's great. Anything else on that, Doc?
I think that was about it.
Alrighty. So yes, we covered everything from growing tissues properly, preventing tissue damage while you're trying to make those gains in the gym. And today we're going to end the podcast with a certain segment. We're going to call it Overrated, Underrated segment for certain topics. And so today we have, Doc and I kind of came up with a list. This list pertains to working out, recovery, supplements, just a few things that I think you're going to find in your journey with getting into the gym and working out and improving your life there. So we want to make sure that you guys understand from our perspective if this is something you should definitely include, or maybe give it a second thought if we think that it's overrated. So this is the underrated, overrated segment. Doc, to start off, long duration cardio, do you feel that is overrated or underrated?
I'd say as a whole, underrated.
Okay.
Mainly because a lot of people, if either one, they're not moving itself, or two, they don't build up the capacity to have the training of the lungs, the heart, the vascular system, which we've touched on previously. So I would definitely say underrated.
So I initially wanted to say overrated, but after hearing Doc, I'm going to put it at properly rated. I think it is just, everyone understands that it's crucial. The reason why initially I was thinking overrated was because if you happen to pick up a Ben Greenfield book, he is a little too adamant on how long distance trainers can maybe damage their heart over time. There's a lot of maybe minutia when it is involved in that, but that's more for the longer impact training that those kinds of athletes do. But I think for those who are day-to-day just trying to get cardio in during the week a few times a week, that doesn't necessarily pertain to that. So no, I think it's properly rated. I know myself, I need to do more cardio, and it's gonna only improve your workouts if you continue to hit that portion of things. Too many times we know we got these bodybuilders that can lift heavy amounts of weight, but they can't even go for a run for a minute because they're out of breath. And only could they benefit from improving that cardiovascular portion of things. So wonderful. All right, we have exercise classes, overrated, underrated, Doc. We might be stirring up some pots here, but what are you saying?
Exercise classes, I would say underrated.
Interesting.
Mainly because if you're trying to work out and if you feel stressed going into an environment at the gym and having the fear of people looking at you, going and work out with a buddy, going and working out at different class, that can, one, build up the different energy systems, but then two, allows you to actually get into the exercise itself. So I'm looking at more the broad perspective. For most people, I think it would be more underrated.
Perfect.
I think most people can get other aspects out of different types of classes, but yeah.
Good. Yeah. I was going to say overrated, and it's not just because I think there are people out there making tremendous growth in their health journeys with exercise classes. But what I do want you to really focus on when it comes to your health journey is being an advocate for yourself and trying to maybe take the initiative of doing those things yourself at some point in time. Now, exercise classes are great. There are times though where I've heard you go into these classes and you are maybe given more guidance through a gentler workout in hopes that they try to get you to sign up for other things. And there are just times where I think a lot of these exercise classes, you show up, and no work has been done, you do the workout, you leave, but there really isn't any extra effort being put towards understanding yourself, understanding those kinds of things. And I'm sure there are plenty of classes out there that hit that. But what I would hope is that you don't just use those classes as a gentle way to kind of get moving. Pick the ones that are going to make you sweat. Pick the ones that you are going to truly be pushed to. And of course, the end goal is to make progress. And so that's the only thing that I have as far as the overrated portion of it. Don't use it as just a way of saying, hey, I made it to that class and I put my Insta up there and I showed that I was there, but was any work really done? And what benefit did you actually get from it? So that's all I have to say about that. All right, number 3, workout attire, overrated, underrated, Doc.
So overrated. I mean, if you look good, feel good, perform good, that's one thing, but just focus on the attire instead of what you're actually trying to do or the energy put in. That's where I have a little bit of a concern.
Yes. I have a tough time with workout attire. I'm sometimes in that gym with pajama pants on if I need to. I got to get to that place. It is what it is. My gym's in my apartment building, so I'm not too worried about workout attire. I would say it's overrated too if you're definitely spending more time on thinking about what you look like versus the actual impact of the gym. And if you're afraid to sweat, if you're afraid to look a little grimaced after that workout, you're not where you need to be when it comes to making health goals and impacts in this fitness journey of yours. So yes, I know it's fun in the beginning to get some new workout gear to get you ready for this year. Absolutely. That's not what we're saying. What we are saying though is stop worrying about what you look like when you're in that gym. Get the hard work in and get those goals completed that you want to get rid of. So already.
Yes.
Number 4, we have overrated, underrated, creatine. Doc.
Yes, I would say underrated.
Mm-hmm.
More for the aspect, if you listened to the podcast earlier, the phosphocreatine system is the first system that you first utilize, and that's not only for muscle energy function, but also cognitive function of how well your cells and neurons are firing as well. So, and then also the mood, there's less depressive symptoms. There's a whole side on that can have improvements. So, I mean, I don't take creatine every day, but it's most days, and I definitely can tell a difference when I do take it. So without a doubt, underrated. Most people should be taking creatine.
I'm in the same boat. Creatine's underrated. And again, we want to help take off any myths when we can. And creatine, I think, does have a little bit of a myth around it. So why we're saying it's underrated is because it is used so entirely by so many metabolic processes in the body. And it is one of the most studied compounds by far.
Yeah.
I mean, it is so much research. You should be taking this every day, even if you don't work out. Mm-hmm. This is something that I think many people will benefit from taking every single day. And a lot of people feel, though, you're going to maybe have more retention in weight and water. Mm-hmm. And a lot of people are thinking, well, if I take creatine, then I'm going to look bulkier. It's absolutely not. That is not going to be the crucial limiting factor in why you're gaining and storing weight. Yeah. It's not the 5 grams of creatine you eat every day, or you consume every day. It's of course the amount of calories you eat, what kinds of foods you're putting into your body. Creatine isn't going to be that limiting or that huge crucial factor to why you're gaining or storing weight. Yes. So no, underrated. Take it every day. Super, super helpful. No, absolutely. All right, number 5. I don't have a lot of experience with, but I'm excited to hear your take, Doc. Smelling salts, underrated, overrated?
Definitely underrated, for sure. It burns, I'm not gonna lie, and I don't use it that often. Very rarely do I but it increases the drive nervous system, the epinephrine. So if you feel like you're sore, if you feel like it's hard for you to get up and do the work, or you're driving around and you can't find a place to park, you just give up, that is where you take that smelling salt. It will get you going, and it will bring you from 0 to probably 150 real quick. But for most people, it'll help. It's a little bit more powerful than a pre-workout.
Dang, that's interesting. We'll have to talk maybe more about that at a future podcast. But for me, I think smelling salts are probably overrated. Again, I have never used them, but you know what? Who's to say that those bodybuilders aren't needing a little bit more push to put up 600 pounds? I'm sure there's a time and reason for everything when something like that is needed. But for the day-to-day person just getting into things, I hope you don't need smelling salts to get your butt off that couch to get into that gym. If you do, hey, perfect. Get into it. But right now, take some salt, put it in water. It's a good pre-workout, get your butt into the gym, and as you consistently continue to do that, you're going to get addicted to it. You're going to love to start seeing the changes that you're seeing. But yeah, absolutely. Smelling salts. There we go. Okay, next one, Doc. I know this one could be probably a whole podcast by itself, but yeah. Underrated, overrated, foam rolling.
Overrated. Mainly because people don't have a good understanding of what they're doing when they're actually foam rolling. Like, it can help get waste products out. It can help, to a certain aspect, rehab damaged muscle, so we can help. But the one caveat that most people forget is pressure with movement. So if you put pressure on, the tissues and muscles are laid down in different fashion to where if you just put compounding pressure, that has an effect more between like the dermis skin and the whole muscle belly fiber type. But to get to the intramuscular function, you need to put pressure where most of the soreness occurs and then allow movement around there so you can help create glide between the tissues more so. So unless you're doing that, foam rolling.
Foam rolling for me, I would say is overrated. And I would say it just because there are more effective ways to recover than once you hit that gym, you come home, you foam roll, you go to bed. I think there are just more ways you can efficiently use your time than to foam roll. Mechanoreceptively, so there are skin receptors called mechanoreceptors that play a huge portion in delivering information to your brain. And they can also help limit pain once they're stimulated. There's a lot of other reasons why someone would want to, I mean, what happens when you stub your toe? The first thing you want to do is you want to grab it. It's because you're actually trying to inhibit the pain reception there using stimulatory mechanoreceptors. And so if someone comes home, they're like, thighs are sore, I gotta grind them out with that foam roller. Yes, you're trying to turn some of those sore pain signals off, but what you should be doing, in my opinion, is getting a protein shake in there, drinking water, maybe dynamically stretching, just fully using your time effectively. And I don't see or have seen good research with effects on recovery and muscle changes when it comes to foam rolling. I just haven't seen it yet. So
That's a really good point.
yeah.
Yeah.
All right, next up, overrated, underrated, subscription-based meals, Doc. Where do you stand?
Previously, based on the cost, I would have said evenly rated, but when I look at now, especially over the past 5 years, I'd say very much underrated, especially when people are struggling to go to grocery stores,
Yes.
cook meals, and then try to be healthier. This takes the whole barrier out of it.
Yes.
I think if you set yourself up wisely, especially with advice from a medical professional, subscription meals, as long as it's healthy, hugely underrated.
That's awesome. And I've done subscription-based meals many times in my life when I've needed it. What you'll find, believe it or not, is I was spending less on a subscription-based program than and it sounds interesting, right? It sounds like, well, if I'm paying so much per meal when I could be making home-cooked meals, spending this much. But what I know a lot of you are doing is you're eating out when you're not having these meals ready to prep for you. So
that or DoorDash.
We know, we're human too. We've done it. And so
yes.
when you can, this is back to podcast 1 when we were talking just about how do you consistently set yourself up for success, having that meal prepared for you. Well, if you don't like to cook, then this is it. This is the way that you can put healthy food into your body consistently, already done for you. You can get it cooked for you each week. You're looking at anywhere between $8 to $12 a meal. Heck, I think last night between my girlfriend and I, we spent close to $50, $20, $25 a meal.
Mm-hmm.
So to say that it's not underrated, it is incredibly underrated. So
Absolutely.
yeah. Okay, we have overrated, underrated on BCAAs. Doc, first let's just talk what BCAAs are and then what you think of that.
Absolutely. So BCAAs are pretty much amino acids that are more based on signaling for tissue growth and which also help rebuild certain areas of tissue, but they're mainly just signaling amino acids.
Yep. Okay.
For the most part. So based on that aspect, and if you just want to intake BCAAs, by all means, very, very overrated for sure. You want to supply yourself, if you're going to use BCAAs, you want amino acids with it, more of the full spectrum of amino acids. You want proper nutrition of like protein coming in at the same time for the rebuilding. But if you're just taking BCAAs, and I've made this mistake myself, just going into that, you're not going to see as much strength gain. You're not going to see as better utilization of your energy systems. So yeah, I'd say overrated as a whole.
I agree. Overrated. From the research that I've read, it doesn't really statistically impact any significance of change when it comes to taking them. I would want you to spend your money on the subscription meals, or put your money towards, those, like a class pass so you can go do workouts. Those are the kinds of things that we would want you to spend your money on. Heck, creatine is probably way better than to spend it on BCAAs. So if you are out there, just give that some thought. We're not here to offend anybody, but we are here to educate you, because we do want to make sure that you're getting the most out of your money and your value of what you're getting. So the last one, this is a beautiful one. I'm glad we added it in. Overrated, underrated of static stretching. Doc, was that overrated, underrated? And then just a brief review of what static stretching is.
So for sure overrated. And static stretch is you're in a position or for a period of time and you're just holding a stretch of the tissues, which if you listened to previously in this podcast, if we stretch any muscle tissue, oftentimes it's going to recoil back to what it's used to. You need a muscle contraction to go to that tissue at length and or during length, thus where the dynamic stretch is way better, especially pre and post. Static stretching, you can improve the range of motion, but you can't necessarily improve the functional range of motion of how you can move in that length after stretching, and it can help to a certain regard for injury rehab, but there's way better uses of your time, way quicker healing you can occur. So for static stretching, very overrated unless you apply muscle contraction, which I don't think many people do.
Yeah, no. You're used to putting your leg up somewhere and holding it for so long, and that's about what most people understand as far as stretching goes. And correct me if I'm wrong, Doc, but there are some studies showing where if you are static stretching before a workout, it can actually decrease your ability to perform, if I'm not mistaken.
Yes, and I'm glad you brought that up too. If you go into longer bouts of stretching, especially within 30 minutes prior to performance of any athletic endeavor, it's going to decrease the amount of energy output of the motor unit signaling to the tissue because everything's already lengthened, it's already been utilized, and it's hard to go back into the contraction relaxation state, especially actin myosin levels. So it'll decrease your performance. However, there's better effects either on the days off of training or afterwards, but even afterwards you have better uses of your time,
for sure.
like you'd say.
Yeah, and so
good point.
Where I stand to overrated, you want to spend your time efficiently. You also want to spend your time to have improvements, not decrease in improvement. So that's what we have there. That is the overrated, underrated segment for everybody. We have episode 2 in the books, everyone. Thank you so much for watching. We truly are thankful for your time and attention if you stayed with us through this entire thing. We're also going to be putting short form content out for everyone so you can at least take the bits and gems of everything that we're saying. Doc is going to put up resources of everything that he spoke about with the graphs and the charts so that everyone has access to that when needed. And if there was anything in the podcast that you wanted either further explanation on or better resources for you to get into this, please let us know. We'll create that for you, and we want to make sure that we give you guys as much value as we can when we're going through these podcasts day to day. So with that is episode 2. Thank you guys so much. Please share, like, subscribe. We appreciate you guys so much. Thank you. That is episode 2. We will see you guys next time, Doc. Woo! See you guys later.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.